The war on drugs has done a great deal more harm than the drugs themselves.
People understand now that it's no more possible just to deal with the drug problem by repressing. We need to change the paradigm.
The prohibitionist drug policies promoted by many countries, including the United States, have just exacted a tremendous toll. That toll is worldwide.
We've passed these laws. We've decided to deal with drug addiction and drug dependency as a crime problem rather than a health problem. And as a result of that, we've empowered the police and our system of justice with this misguided idea that we can somehow threaten people into better choices about drug use and drug dependency.
Today, there are people in prisons in the US and in China and in Brazil and in Bolivia that shouldn't be there. They're there for personal possession of small amounts of drugs. They're there for growing small amounts of coca.
In Indonesia, we have some of the most punitive drug policy in the world. We have the death penalty for drugs, we have widespread incarceration, and we have judicial corporal punishment. This just exacerbates the situation and deteriorates general health.
In the Arab countries in specific, drug abusers and drug users are seen as criminals and they are denied their basic rights.
In most of the countries in West Africa, there has been an overemphasis on penal sanctions and criminalization and imprisonment, basically overburdening an already strained criminal justice system.
The drug policies in African countries, they all seem like war policies. Law enforcement, soldiers.
Venezuela y Caracas particularmente, la segunda ciudad más violenta del mundo. Tráfico de drogas, secuestro.
In Latin America, we are waging the war that the United States would like to wage against its own consumers. We pay for that with hundreds of thousands of deaths every year.
In any war, there's going to be collateral damage. And in the war on drugs, because of the regulations around the use of morphine, patients with cancer or other diseases that cause severe pain have often been collateral damage.
Drug policies that we currently have today have, without a doubt, failed youth on so many different levels. Bad policy really costs lives.
We spend a lot of money globally on punitive responses to drugs, and we haven't seen reduction in drug use. We haven't seen reduction in supply.
If we'd spent the equivalent $1 trillion that we spent on the drug war on social development issues, the drug problem would probably take care of itself with some moderate regulatory frameworks.
Maybe it can change now. There's a hope for change in drug policy today that I have not seen at any other time in my life.
Articulating a clear, concise drug policy that doesn't undermine public health is something that needs to happen across the world.
We have the opportunity now. The awareness about this problem is increasing. There are new ideas that are coming that could definitely influence the global debate.
The philosophy of a new drug policy is the same for all countries of the world. It's the respect of human rights.
You don't have to wait for people to stop using drugs before you can offer them help. Instead, you say to people, it's more important for us to help you progress toward any positive change than to demand abstinence only.
A ideia toda é de adotar as técnicas mais avançadas de abordagem e considerar o problema da droga um problema de saúde pública e não um problema criminal.
In different parts of the world, alternate solutions look different ways. In Vietnam, it may look like an alternative to a forced labor camp. In Eastern Europe, it may look like a needle and syringe program. In East Africa, it may look like a program that helps people have access to a paralegal so that they don't have to wait for a year before appearing before a judge and getting out.
Each country has to come up with their own policy, with their own action plans.
Countries are beginning to sort of say, okay, what can we do in our context? What can we learn from other jurisdictions? The ideas are really floating around.
From Colorado, Washington, to Alaska and Oregon, DC, Uruguay for that matter. We're trying to replace a failed prohibitionist policy with a thoughtful, responsible regulatory policy.
The importance of what's happening in Uruguay or Colorado is the recognition that the one dominant response doesn't need to be zero tolerance and just say no. Portugal is an interesting example. They decriminalized all drugs, possession of up to 10 days worth. No criminal penalties.
It essentially said, We're not going to put anybody behind bars simply for drug use or drug possession. And it turns out, now that the evaluations have come out after over a decade, illicit drug use did not go up.
What we are now hoping to see happening is the beginning of an evaluation of the last 50 years of failures and the opening up of a real dialogue.
Whenever there are global drug policy discussions, people talk about medical use of controlled substances.
We're going to have next year the debate on the United Nations about the conventions and what are the rules to fight the problem of drugs.
With UNGASS, I think one of the most important things we want to make sure that the United Nations and UNGASS knows is that it's about getting back to human rights, human dignity, and making sure that UNGASS and the UN are on the same page as we are on the ground.
I don't hear people say if they did the crime, they should do the time. I don't hear people say that folks deserve to be locked up for 15 and 20 years. Now what I hear them say is how can we reduce the amount of drugs in our community and how can we make services more available?
This is the shift from ideology and a moralistic point of view to a pragmatic but also humane, human rights respecting perspective. This shift is not yet realized in drugs, and this is the next step we have to do.